Question 1. Given the circumstances, Mr. Allen, a 45-year-old male with a history of smoking, presents with shortness of breath and a persistent cough, his chest radiograph reveals a mass in the right upper lobe with associated lymphadenopathy. What is the most appropriate next step in his management? A. Immediate biopsy of the mass. B. A high-resolution ESO scan to further evaluate the mass. C. Empiric antibiotic therapy for possible pneumonia. D. Observation with repeat imaging in 6 months. Answer. Correct answer. B. A high-resolution ESO scan to further evaluate the mass. Explanation. In the context of a suspicious mass on a chest radiograph in a smoker, the most appropriate next step is to perform a high-resolution CT scan for better characterization of the mass, its size, location, and possible involvement of surrounding structures. This will help guide biopsy or further diagnostic procedures. Biopsy A may be indicated after imaging, but the CT scan is needed to assess the characteristics of the mass first. Empiric antibiotic therapy C is inappropriate unless an infectious etiology is strongly suspected. Observation D would be inappropriate given the suspicion of lung cancer, which requires prompt investigation. Question 2. In the context of musculoskeletal imaging, which of the following best describes the appearance of osteoarthritis on plain radiographs? A. Narrowed joint spaces, osteophytes, and subchondral sclerosis. B. Perirticular soft tissue swelling and erosions. C. Joint space widening with well-defined osteophytes. D. Presence of cystic lesions in the subchondral bone. Answer. Correct answer. A. Narrowed joint spaces, osteophytes, and subchondral sclerosis. Explanation. Osteoarthritis OA is characterized by the gradual loss of articular cartilage leading to narrowed joint spaces. Osteophytes, bone spurs, develop as a response to the wear of cartilage, and subchondral sclerosis occurs as the underlying bone thickens due to increased stress. Perirticular soft tissue swelling and erosions B are more commonly seen in inflammatory arthritis like rheumatoid arthritis. Joint space widening C is not typical of OA but can be seen in conditions like hypermobility disorders. Cystic lesions D are more associated with osteonecrosis or other degenerative joint diseases but not directly with OA. Question 3. Based on the information provided, a 60-year-old female presents with complaints of abdominal pain, weight loss, and jaundice. Her imaging studies show a mass in the head of the pancreas. What is the most likely diagnosis based on her imaging findings? A. Chronic pancreatitis. B. Pancreatic adenocarcinoma. C. Pancreatic pseudocyst. D. Hepatic metastases. Answer. Correct answer. B. Pancreatic adenocarcinoma. Explanation. Pancreatic adenocarcinoma is the most likely diagnosis in this case, particularly given the presence of a mass in the head of the pancreas along with symptoms of weight loss, abdominal pain, and jaundice. These findings are highly suspicious for malignancy as this location is the most common site for pancreatic cancer. Chronic pancreatitis A can also cause a mass-like effect, typically present with chronic abdominal pain and a history of alcohol use or gallstones. A pancreatic pseudocyst C would more commonly follow an episode of acute pancreatitis. Hepatic metastases D would typically not present as a primary mass in the pancreas. Question 4. What would be the most appropriate imaging modality to assess a suspected stress fracture in a 20-year-old athlete who presents with localized pain over the tibia, especially considering the early stages of the fracture? A. MRI. B. X-ray. C. CT scan. D. Bone scan. Answer. Correct answer. A. MRI. Explanation. Stress fractures, especially in the early stages, are often not visible on X-rays. MRI is the most sensitive imaging modality for detecting early stress fractures and can show bone marrow edema associated with stress reactions before a fracture line is visible. X-rays B may not reveal the stress fracture early on, especially in non-displaced KC. CT scan C can be helpful in detecting complex fractures, but is not typically the first choice for stress fractures. A bone scan D can be used, but is less specific than MRI, as it can show increased uptick in conditions like infections or inflammatory processes. Question 5. Considering the evidence from recent studies, which of the following artifacts can occur in MRI imaging due to motion during scanning? A. Ghosting. B. Beam hardening. C. Ring artifact. D. Methyl artifact. Answer. Correct answer A. Ghosting. Explanation. Ghosting is a common MRI artifact that occurs due to patient motion during the scan. The motion causes blurring or duplicate images, usually seen in the phasing code direction. Beam hardening B is an artifact seen in CT imaging, not MRI, caused by the X-ray beam passing through dense structures like bones. Ring artifacts C typically occur in MRI due to equipment malfunction or in the gradient coil. Metal artifacts D are seen in both MRI and ET, typically due to the presence of metal implants which cause distortion of the surrounding image. Question 6. Which of the following best describes the role of contrast agents in MRI? To improve the visualization of soft tissues and blood vessels. B. To increase the signal intensity of bone structures. C. To reduce scan time by shortening the acquisition period. D. To improve the resolution of bony structures. Answer. Correct answer A. To improve the visualization of soft tissues and blood vessels. Explanation. Contrast agents in MRI are primarily used to enhance the visualization of soft tissues and blood vessels. They alter the magnetic properties of tissues, improving differentiation between normal and abnormal structures, especially in conditions like tumors or inflammation. Contrast agents are not typically used to visualize bone structures. B. Reduce scan time. C. Improving bone resolution. D. Is not the role of contrast agents in MRI, as bone itself is naturally visible due to its density. Question 7. When presented with a can show in a dilated left colon and a transition point at the splenic flexure, what is the most likely diagnosis? A. Acute diverticulitis. B. Colon cancer. C. Bowel obstruction due to sigmoid volvulus. D. Acute mesenteric ischemia. Answer. Correct answer C. Bowel obstruction due to sigmoid volvulus. Explanation. A dilated colon with a transition point at the splenic flexure is highly suggestive of bowel obstruction caused by a sigmoid volvulus. This condition occurs when the sigmoid colon twists on itself, causing obstruction and distension. Acute diverticulitis typically shows inflamed diverticula but not a transition point. Colon cancer B might present with a narrowing the site of a tumor, but the transition point is typically not at the splenic flexure. Acute mesenteric ischemia D would typically cause bowel infarction and not a transition point at the splenic flexure. Question 8. In the absence of any specific findings on conventional imaging, which of the following is the first imaging modality of choice when diagnosing brain metastases? A. CT brain with contrast. B. MRI brain with contrast. C. PET-AT. D. Cerebroangiography. Answer. Correct answer B. MRI brain with contrast. Explanation. MRI brain with contrast B is the imaging modality of choice for diagnosing brain metastases, as it provides superior soft tissue contrast and can detect small lesions that may not be visible on CT, while CT brain with contrast A can be used to MRI is more sensitive in detecting brain metastases, particularly in the early stages. PET-C is not the first modality for brain lesions, as it is more useful in identifying distant metastases rather than local brain lesions. Cerebral angiography D is more commonly used for evaluating vascular malformations or arteriovenous fistulas, not for metastatic disease. Question 9. A 70-year-old patient presents with a swollen, painful knee after falling. Plain radiographs show no fractures, but the joint appears effused. What is the next most appropriate step in evaluating this patient? A. MRI of the knee. B. Arthrocentesis and analysis of synovial fluid. C. CT scan of the knee. D. Observation for 48 hours. Answer. Correct answer B. Arthrocentesis and analysis of synovial fluid. Explanation. arthrocentesis B is the most appropriate next step for evaluating a knee joint effusion. This procedure allows for the analysis of synovial fluid, which can help diagnose the cause of the effusion, whether it's due to infection, crystal-induced arthritis, e.g. gout or hemorrhage. MRI can be used to assess soft tissues, but is typically not first line when the primary concern is the effusion. CT scan C is more useful for bony fractures, not soft tissue pathology or joint effusion. Observation D would delay proper diagnosis and treatment. Question 10. Which of the following is the primary benefit of using contrast-enhanced ultrasound and liver imaging? A. To detect liver tumors in their early stages. B. To assess liver fibrosis. C. To identify gallstones in the biliary tree. D. To evaluate blood flow in liver lesions. Answer. Correct answer D. To evaluate blood flow in liver lesions. Explanation. Contrast-enhanced ultrasound D is particularly useful in evaluating blood flow within liver lesions, which can help differentiate benign from malignant tumors. It enhances the visualization of vascular structures, allowing for better assessment of lesions such as hepatocellular carcinoma. It is not typically used for detecting liver tumors in their early stages, A. Liver fibrosis, B. Or identifying gallstones, C. Which are better evaluated with other imaging modalities like ET or MRI. Question 11. In the context of diagnosing abdominal trauma in a 45-year-old male patient who sustained a high-impact motor vehicle collision, which imaging modality would be most appropriate for the initial evaluation? A. CT scan of the abdomen and pelvis. B. Abdominal ultrasound. C. MRI of the abdomen. D. Plain X-ray of the abdomen. Answer. Correct answer A. CT scan of the abdomen and pelvis. Explanation. For trauma patients with suspected abdominal injury, especially following high-impact collisions, a CT of the abdomen and pelvis is the most commonly used and effective initial imaging modality. CT provides detailed visualization of organs and vasculature, aiding in detecting solid organ injuries, e.g. liver or spleen lacerations, hematomas, and free fluid. Peritoneal cavity, which is crucial for management decisions. Ultrasound is useful in screening for free fluid, fast exam, but CT offers superior sensitivity for more extensive trauma. MRI is generally not indicated for acute trauma unless there is suspicion of spinal injury. Plain X-rays offer limited value in trauma evaluation. Question 12. What is the primary risk associated with contrast administration in patients with chronic kidney disease during CT imaging? A. Hypotension due to contrast-induced nephropathy. B. Allergic reactions leading to anaphylaxis. C. Contrast extravasation and tissue necrosis. D. Contrast-induced nephropathy sin. Answer. Correct answer D. Contrast-induced nephropathy sin. Explanation. Contrast-induced nephropathy sin is the most significant risk in patients with chronic kidney disease undergoing contrast-enhanced CT scans. Sin refers to acute kidney injury that occurs within 48 to 72 hours following contrast administration, often resulting in a decline in renal function. It is associated with the use of iodinated contrast agent, particularly in patients with pre-existing kidney dysfunction. While allergic reactions and contrast extravasation are also risks, sin is the primary concern in these patients. Preventive measures include ensuring adequate hydration and considering alternative imaging methods or contrast agents. Question 13. Given the circumstances of a 60-year-old female presenting with a progressive headache and visual disturbances, what imaging modality would you select to evaluate for a pituitary adenoma? MRI of the brain with gadolinium contrast. B. CT of the brain without contrast. C. Chest X-ray to rule out metastases. D. MRI of the orbits. Answer. Correct answer A. MRI of the brain with gadolinium contrast. Explanation. MRI with gadolinium contrast is the imaging modality of choice for evaluating suspected pituitary adenomas. It offers high soft tissue contrast resolution, allowing detailed visualization of the pituitary gland and its surrounding structures. Pituitary adenomas are most commonly visualized using MRI and contrast. Enhances tumor delineation. Identification of small lesions. CT is less sensitive for soft tissue and would not provide the same level of detail in this case. Chest X-ray is not relevant for primary pituitary pathology, and MRI of the orbits is unnecessary unless there is suspicion of an orbital mass. Question 14. When considering a patient with suspected lung cancer, which of the following imaging findings would most likely suggest the presence of a centrally located tumor, A round, well-defined nodule in the peripheral lung fields, B a mass located near the hilum with lymphadenopathy, C a diffuse interstitial pattern with fibrosis, D a honeycombed pattern in the lower lobes? Answer. Correct answer. B a mass located near the hilum with lymphadenopathy. Explanation. Centrally located lung tumors, such as those originating from the main bronchus or large airways, are most commonly identified as masses near the hilum of the lung on imaging, often accompanied by hilar or mediastinal lymphadenopathy. These tumors typically present as obstructive lesions causing atelectasis or pneumonia in the adjacent lung. A peripheral nodule answer is more characteristic of a peripheral lung tumor. Interstitial patterns, answers C and D, are generally associated with interstitial lung diseases, not cancer. Question 15. To better understand the evolution of an osteoarthritic knee, a 65-year-old patient is undergoing a series of radiographs. Which radiographic sign would be most suggestive of advanced osteoarthritis? A. Joint space narrowing with osteophyte formation. B. Bone sclerosis with no joint space narrowing. C. Periosteal new bone formation. D. Cortical thinning and multiple fractures. Answer. Correct answer. A joint space narrowing with osteophyte formation. Explanation. Advanced osteoarthritis is often characterized by joint space narrowing, which reflects the loss of articular cartilage combined with the formation of osteophytes, bone spurs at the margins of the joint. These findings are classic indicators of degenerative joint disease. Bone sclerosis can also occur but may not always correlate with advanced disease. Periosteal new bone formation is more typical of inflammatory arthritis. Cortical thinning and fractures are more indicative of metabolic bone diseases such as osteoporosis. Question 16. Under the assumption that a 50-year-old male patient presents with a lung mass on a chest radiograph, which of the following imaging modalities would be most useful for further characterization of the lesion? A. CT scan of the chest. B. Ultrasound of the chest. C. MRI of the chest. D. Nuclear medicine bone scan. Answer. Correct answer. A CT scan of the chest. Explanation. AK of the chest is the gold standard for characterizing lung masses seen on chest radiographs. It provides detailed information about the size, location, and characteristics of the mass, and it helps in assessing its relationship to surrounding structures. CT also enables better assessment of possible lymph node involvement, staging, and the identification of other lesions. MRI. Ultrasound can be used in some cases. They are not typically first-line modalities for lung mass evaluation. Nuclear medicine bone scans are used primarily for bone metastases detection. Question 17. Considering the case of a 72-year-old female with a history of right breast cancer, which radiologic feature is most indicative of breast cancer recurrence on mammography? A well-circumscribed, smooth mass. B. Spiculated, irregular mass with microcalcifications. C. Dense, diffuse breast tissue. D. Diffuse asymmetry without a distinct mass. Answer. Correct answer. B. Spiculated, irregular mass with microcalcifications. Explanation. A spiculated, irregular mass with associated microcalcifications is a classic radiologic finding suggestive of breast cancer recurrence or a new malignancy. Spiculated margins indicate that the tumor has infiltrated surrounding tissues, and microcalcifications often correlate with malignancy, particularly in the setting of invasive carcinoma. Well-circumscribed smooth masses are more likely to represent benign lesions, while diffuse breast tissue density and asymmetry are less specific and may not provide a definitive diagnosis. Question 18. What is the primary principle of radiation protection for both patients and staff during fluoroscopic procedures? A. Maximizing radiation exposure to achieve optimal imaging. B. Utilizing the lowest possible radiation dose to achieve diagnostic quality. C. Ensuring that radiation is limited to only one view during fluoroscopy. D. Relying solely on protective shielding for radiation safety. Answer. Correct answer. B. Utilizing the lowest possible radiation dose to achieve diagnostic quality. Explanation. The primary principle of radiation protection, both for patients and staff, is to use the as low as reasonably achievable ALARA principle, which advocates minimizing radiation exposure while maintaining diagnostic image quality. This involves optimizing imaging parameters such as dose, exposure time, and technique. Shielding is important. It is not a substitute for minimizing dose. Relying solely on protective shielding or limiting views would not effectively ensure patient safety or adequate diagnostic information. Question 19. Given the circumstances of a young female patient with no significant medical history presenting with an ankle sprain, which imaging modality would you choose to assess for potential fractures? A. MRI of the ankle. B. Plain X-ray of the ankle. C. CT scan of the ankle. D. Ultrasound of the ankle. Answer. Correct answer. B. Plain X-ray of the ankle. Explanation. For initial evaluation of a suspected fracture following an ankle sprain, a plain X-ray is the modality of choice. It is cost-effective and widely available, and it provides sufficient information to identify fractures or other bony injuries. MRI is more useful for soft tissue injuries and is generally not required for initial fracture evaluation. CT scans are useful. Complex fractures or when the X-ray findings are inconclusive, but they are not routinely performed unless necessary. Ultrasound is not typically used for fracture detection. Question 20. Based on recent advancements in the management of cerebral aneurysms, which imaging modality is recommended for preoperative assessment to plan for surgical or endovascular intervention? A. CT angiography (ETA) of the brain. B. Plain X-ray of the skull. C. MRI of the brain without contrast. D. Ultrasound of the brain. Answer. Correct answer. A. CT angiography (ETA) of the brain. Explanation. CT angiography (ETA) of the brain is the recommended modality for preoperative assessment of cerebral aneurysms. It allows for detailed visualization of the aneurysm's location, size, and relationship with surrounding vessels, which is crucial for planning surgical or endovascular interventions. MRI can also be useful but is less commonly used for preoperative aneurysm evaluation compared to CTA. Plain X-ray does not provide sufficient detail, and ultrasound is not effective for imaging intracranial aneurysms. Question 21. A 35-year-old woman presents with amenorrhea and galactorrhea. Serum prolactin is elevated. What is the most appropriate initial imaging study to evaluate the suspected lesion? A. CT head without contrast. B. MRI pituitary with gadolinium. C. Skull X-ray. Lateral view. D. PET-ET scan. Answer. Correct answer. B. MRI pituitary with gadolinium. Explanation. MRI with gadolinium is the investigation of choice for evaluating suspected pituitary adenomas. It provides high-resolution images of the cella and surrounding structures, critical for assessing micro or macroadenomas responsible for hyperprolactinemia. Question 22. A 68-year-old smoker presents with hemoptysis. A contrast-enhanced CT scan reveals a right upper lobe lung mass encasing the right main bronchus. What is the most likely diagnosis? A. Pulmonary hematoma. B. Adenocarcinoma. C. Squamous cell carcinoma. D. Bronchial-alveolar carcinoma. Answer. Correct answer. C. Squamous cell carcinoma. Explanation. Squamous cell carcinoma commonly arises centrally, often involving the major bronchi. It is frequently associated with hemoptysis due to mucosal ulceration and is strongly linked to smoking. Question 23. A child with a history of congenital heart disease presents with cyanosis. Chest radiograph shows boot-shaped heart. Which condition is most likely? A. Total anomalous pulmonary venous return. B. Tetralogy of Fowler. C. Transposition of great arteries. D. Truncus arteriosus. Answer. Correct answer. B. Tetralogy of Fowler. Explanation. Tetralogy of Fowler is characterized by right ventricular hypertrophy leading to the classic boot-shaped heart on chest X-ray, along with decreased pulmonary vascular markings. Question 24. A 70-year-old male with chronic renal failure undergoes a contrast-enhanced CT. 48 hours later, serum creatinine increases. What is the most likely explanation? A. Rhabdomyolysis. B. Acute tubular necrosis from ischemia. C. Contrast-induced nephropathy. D. Obstructive nephropathy. Answer. Correct answer. C. Contrast-induced nephropathy. Explanation. Contrast-induced nephropathy (CIN) is an acute decline in renal function following iodinated contrast administration, typically within 4-8-72 hours, especially in patients with pre-existing renal impairment. Question 25. A 29-year-old female with multiple sclerosis presents for follow-up. Which MRI sequence is most sensitive for detecting active demyelinating plaques? A. Twaited with gadolinium. B. FLAIR. C. Twaited. D. Dwyer. Answer. Correct answer. A. Twaited with gadolinium. Explanation. Twaited post-gadolinium sequences highlight active inflammation as demyelinating plaques that are currently active enhance due to breakdown of the blood-brain barrier. Question 26. 55-year-old man with chronic alcoholism presents with altered sensoria. CT brain shows symmetric low attenuation in the mammillary bodies and periaqueductal grey matter. What is the most likely diagnosis? A. Wernicke encephalopathy. B. Markov-Bignami disease. C. Korsakoff psychosis. D. Hepatic encephalopathy. Answer. Correct answer. A. Wernicke encephalopathy. Explanation. Wernicke encephalopathy classically affects the mammillary bodies and periaqueductal grey matter. It's associated with thiamine deficiency, particularly in alcoholics. Question 27. A 40-year-old male presents with acute chest pain. CT, the aortogram shows an intimal flap and separation of true and false lumens in the ascending and descending aorta. What is the Stanford classification? A. Type B. B. Type A. C. Type C. D. Type 1. Answer. Correct answer. B. Type A. Explanation. Stanford type aortic dissections involve the ascending aorta and require urgent surgical management. Type B involves only the descending aorta. Question 20. A 45-year-old woman presents with right upper quadrant pain. Ultrasound shows gallstones and gallbladder wall thickening. What is the next best imaging step to confirm cholecystitis? A. MR abdomen. B. CT abdomen. C. HEDA scan. ERE. Answer. Correct answer. C. HEDA scan. Explanation. HEDA hepatobiliary immunodiacetic acid scan is the gold standard for diagnosing acute cholecystitis. Non-visualization of the gallbladder indicates cystic duct obstruction. Question 29. A trauma patient presents after a fall. CT cervical spine reveals bilateral C. anterior and posterior arch fractures. Which of the following terms best describes this injury? A. Jefferson fracture. B. Hangman's fracture. C. Odontoid fracture. D. Clay-Shoveler's fracture. Answer. Correct answer. A. Jefferson fracture. Explanation. A Jefferson fracture is a burst fracture of C. atlas involving anterior and posterior arches, typically due to axial loading, such as diving or falling on the head. Question 30. A 60-year-old female with a history of breast cancer presents with hip pain. Bone scintigraphy shows increased uptake in the pelvis and spine. What does this most likely indicate? A. Osteomalacia. B. Paget's disease. C. Metastatic disease. D. Rheumatoid arthritis. Answer. Correct answer. C. Metastatic disease. Explanation. In a patient with no malignancy, multiple foci of increased tracer uptake on bone scan are highly suggestive of osseous metastasis, particularly in axial skeleton.